If you could each take a second and introduce yourself in chat. And today's prompt is, what are you doing for self-care? So just who you are, your organization, and what you're doing for self-care. And I'll start. I've been cooking a lot. I made Parmesan crackers. You guys want the recipe? Take Parmesan cheese and you put it together in just like on a cookie sheet, like in a little round. Put it in the oven for 8 to 10 minutes, and then you end up with crackers. Anyway, just thought I'd share. Okay, my name is Petra. I'm with Thrive Alliance. I think everybody here knows me. We really appreciate all of this partnership on the updates and education around COVID. We all hoped that we would be done by now, but luckily we can all turn on a dime because we're not done. And new stuff is coming up. So we're really grateful to have Laura and Trish here to talk about that. A couple of fun things coming up from Thrive that we hope you can join us for in February. On February 22nd, we're going to do a how to run for office. I'm going to have a couple of recent city council members talk about that because there are big elections coming up in June and it's not too late. And then we also have our environmental sustainability, which again, all of our programs are open to everyone. We're going to be talking about the future of transportation in San Mateo County. So we hope you can join us for either of those towards the end of February. In the meantime, for this meeting, we're going to have about half an hour of updates and questions. And then after that, we're going to be doing some real specific sharing. So with that, I'm going to turn it over to Helen.
Thanks, Petra. It's great to see everyone. Welcome. I want to welcome our special guests, Laura and Trish Irwin. They're from our county health department. And I know that there's been a lot happening with COVID in these past few months, a lot of changes, a lot of updates. So we're really grateful that they're able to take the time to be with us today. And I'm going to go ahead and hand it over to Laura and Trish.
Great. Thanks, Helen. Trish, let me know if you want to jump in at any time. So I'll just briefly introduce, I think, both of us, what our roles are. So my name is Laura Shi. I'm a COVID-19 program manager, and I report to Trish, actually, and Trish oversees our county testing and vaccination programs. And my part today is to share a little bit about our testing program. So just wanted to share some updates. I know that Dr. Curtis Chan, I believe, has been here in the past speaking to some of the clinical guidance. So I will try to stay away from that a little bit and just speak more to generally where we are in terms of county testing sites and our approach and things like that. Helen also shared there was interest in learning more about kind of antigen test kits flowing out from the county. So I don't have as much information on that, but I'll just share briefly that currently we have 2 buckets of antigen test kits. One is from the CDPH allocation to the counties. For that allocation, what county is doing is distributing 1 kit per family in the federal and state subsidized childcare programs. But we do have another bucket through the county manager's office, which has purchased additional antigen test kits, and I believe is waiting for them to come in. And there is a prioritization process right now, I think, where folks are trying to get feedback and see about how to establish the avenues for distributing those test kits through, say, existing programs or existing avenues of healthcare. So that's kind of still up in the air right now. We don't have more concrete information about that. In terms of kind of our testing clinics, what we're trying to do overall for the county sponsored or county affiliated testing clinics is to shift away from kind of community-based once-a-week sites, which we had in various modalities, to multiple day-a-week sites, thinking approximately like 3 days a week minimum at any one location. And the reason for this shift is really a public health reason that Dr. Chan very heavily pushed, and it has been for a while. And it's because when there are just once a week test sites. What it does sometimes is can have a negative impact on the local community as opposed to a positive one, because it might encourage folks who need a test on a certain day based on symptoms or based on exposure to wait until the clinic that is closer to them, a little more convenient and accessible to them, it rolls around. So we definitely recognize that not everyone can always make it to another clinic, but we don't want to actually make things worse in some of these communities, because we've heard that people do wait if there is a local test clinic that is more accessible than the other ones, and they would choose to wait to get tested. So they might wait 5 days instead of going to another test clinic. So that's the public health reasoning behind our overall strategy of shifting the sites from some of the once a week sites that still remain to multiple day a week sites. And this shift was planned in a phased approach from around the end of December through January. And of course, the Omicron surge has kind of put a wrinkle in some of it. But we are continuing to make that shift. What that currently looks like in terms of some of the moving pieces around clinics is that there are some sites where we are expanding coverage in terms of days of the week, such as Jefferson High School in Daly City. We're working with them to try and see if we can find a multiple day a week site near them, since they're once a week. Bayshore School in Daly City, we're expanding to 3 days a week. Working with the city of South San Francisco to find multiple day a week sites there. Trying to find another site in North Fair Oaks that can host multiple days a week that's more accessible to some of the folks who are on foot than the 7 day a week Bay Road Curative site. In Pacifica, I think we're also going to be expanding from 1 to 3 days a week. So there are definitely a lot of moving pieces these days. What we've also seen at the same time is that demand has dropped quite a bit just in the last week or so. So 2 weeks ago, I think our sites ran about 20,000 tests, and last week it was closer to 12,000. So, and we've heard this from vendors as well, that across the board, just in the last week or so, things have dropped quite a bit in terms of demand. We recognize that are still considerable barriers to some populations to accessing these test clinics. Some of the main ones that we are aware of and trying to work on is kind of registration and appointment making challenges due to language barriers or technology barriers, physical accessibility due to distance or lack of transportation, maybe days or hours that are not accessible due to work schedules, childcare issues, things like that. So again, that is one of the reasons that we're trying to expand coverage in the sites that are hosting to 3 days a week, to provide more accessibility, continuing to work with partners on establishing sites if the existing ones are not accessible. And also, I think moving forward that we would want our contracted partners to really also focus on assisting with outreach activities that include, say, registration at existing community sites, et cetera. But we're definitely very interested in hearing from all of you, what are the barriers and gaps for your communities? I think whenever we hear of a barrier or a gap or an additional testing clinic need, there are multiple ways of meeting that need. That kind of depends on the specific situation and location, site availability. Every testing vendor is a little bit different in terms of how flexible they can be, what kind of modalities they offer. So for public testing clinics that can be stood up, we might help connect to a private vendor such as Curative for direct partnership, or we might facilitate a private vendor arrangement, or we might be able to request a state vendor, the state testing vendor, LHI OptumServe, come in. And of course, those all have different pros and cons in terms of lead time, flexibility, et cetera. There are 2 other resources from the state, from CDPH, for organizations that do want to test their populations. What we've heard earlier on is that it was quite onerous and challenging to organizations to actually get through the setup process for these programs, but they do have two programs. One is based on antigen testing, and the other one is based on PCR testing. So I can maybe in the chat, I'll drop some links to those two programs for organizations who want to submit a request to participate. I think that's mostly what I have. So happy to open it up to questions and discussion, and also I'll maybe just pause and see if Trish wants to add anything as well.
Good morning, everybody. Thanks for having us here for the meeting. I think I'll pause. Laura just gave you a lot of information, so let's pause, maybe see if you have any questions, comments, feedback, and then if you, if there's time allowed, I can also talk to you about vaccinations and kind of what we're doing in the county for vaccinations, if that is of interest or not. So maybe just open it up, Helen, to if there's any questions or comments from any folks.
Thank you both. Yes. Do we have any questions from the group about testing?
I had a comment. Can you hear me?
Yes.
Thank you. I noticed that a lot of people were requesting appointment-free walk-ins for testing because they wanted, and they were unable to get, when they were backed up, they were unable to get appointments that made sense within their infectious period. You know, they would be 1 week out, 5 days out before they could get a test. And yeah, I mean, I guess now that the testing is going down, it will be a good point that maybe people be able to get walk-ins again, because I feel like it's important to get the test right away as soon as possible. That's all. And thank you.
For sure. I mean, I think, you know, what we've been challenged with COVID since March of 2020, is it now? Is this sort of up down, you know, like when I took over testing in June of last year, and with the idea that I'd be closing up all the testing sites and closing up all the vaccination sites in the county because we're done June 15th, governor declared it over, right? And then instead we had this lull like right at the end of June, and all of a sudden Delta hit, and then we were going up again, and we ramped up our testing again. And so we from county health are really trying to figure out, how do we do this where we can draw back when we need to and then ramp up quickly when we need to. And it's not perfect by any means, and just would really, you know, super apologize that we are not on top of it. We, you know, for the Omicron thing really hit all of us super hard. We tried with the county manager to ramp up as quickly as possible. We kind of ran into the virus kicks problem and different things like that. So totally hear that. And we really, what our kind of, our goal at all of our sites really is to make them as accommodating to the communities in which they're serving, which we know is mostly walk-ups. That's true for my vaccine clinics as well as for the testing sites. So that's really our modality that we want to go to, but we also have to be mindful of the vendors who may have staffing issues or who may be kind of challenged in their own way and stuff like that, and only have a certain capacity. I mean, Laura can speak to it, but they basically were going over capacity every single day, every site for like about 4 weeks with their staffing. Their staffing should have been maybe doing 200 and they were doing 400. So they were trying, but it just, the demand just blew it out of the water basically. So.
Yeah, thanks Trish. And thanks Colleen for your comment and your comment in the chat. We really appreciate that. So just to share, if it's helpful to know how the vendors generally operate, the vendors are all different. There are some that really go based on walk-ins, no appointment needed, but I think the majority go based on appointment based, and how Curative and LHI OptumServe work they're also a little bit different. So there are primary vendors for our county-based clinics. LHI OptumServe is a state vendor. They are absolutely appointment-based. And what they do is the site lead on the ground looks at how they're doing with respect to appointments, how many no-shows there are, how many pending appointments there are for that current time window. And they can decide, okay, are we able to accommodate walk-ins or not? Of course, before the surge, when no one was at capacity, really walk-ins were no problem. They weren't preferred. They were never the model for LHI OptumServe, but they could generally be accommodated. Of course, during the surge, that totally changed where, everyone was at capacity. So they are staffing for a certain amount of appointments. They are supplied for a certain amount of appointments. And so it is really at the site lead's discretion, and that might change hour to hour, day to day, right? So like Trish was saying, we had one of our minibuses at some sites there. They were staffed and supplied supposedly for 132 appointments, and they were doing 400 some for a couple of weeks based on demand, which still might mean that they can't take all the walk-ups. What I'm seeing more recently is that there are many, many no-shows for these appointment-based vendors, I think, because people are trying to find an appointment, booking out further, and then as they find another opportunity, they're not showing up to the appointment that they may have booked that's a little bit further in the future, right, and not canceling. So maybe as many as a third of the appointments end up being no-shows. What we see in the numbers is that the vendors are quite good at filling those with walk-ins. So they are still going to capacity in terms of their volume. It just might be a different balance of appointments versus walk-ins. But more recently, I'm finally seeing many more appointments available. So of course, that means on the ground, they're likely more able to take the walk-ins. Same with Curative, based on their numbers at our big sites, there is a significant number of walk-ins out of those. And I think they also try and titrate how many appointments they release based on the staffing and supply issues so that they are not overrun and they can guarantee that the folks with appointments get seen, and then they take as many walk-ins as they can.
Hi, good morning. This is Wendy from Casa Círculo Cultural. Hi, Laura. I just have a comment. We have been trying to help some of the folks that previously come to our site to do the testing. But one of the things that we're seeing is that Curative doesn't share the database. For example, I was trying to do 3 appointments today, and they always come to our site to do the appointment. So we, the information is on the system. But when I try to do the appointment for the Bayside Road, they say that no, you have, that person has to have been on that site before in order to use the appointment reference number, the previous one. So for us, sometimes it's kind of, for our communities, it's kind of sometimes hard because right now they send a text, I need an appointment, and we're trying to do it, but they are working. And the Curative site is sending a code to their phone. So it's well, they have to take time from the work. And sometimes for some people, it's not easy to take that time, to give me the information or to set up the appointment by themselves. So my question is why Curative doesn't have all, the access to all the database. So they will be faster, because before we only put the patient has come to us and all the information was there. So we didn't have to put all the information again. But this time we have to put everything back again. So for a community, it's kind of hard sometimes because they are working in the morning, so they don't have time to be on the call, 5 or 10 minutes while we do all this. So that is my question. Thank you.
Yeah, thank you, Wendy. And thanks for sharing that challenge with us. I can definitely ask Curative if there are any better ways for the organizations that are helping with registration and doing registration on the fly with their community members, and see if there are any workarounds, or if not, if we could really push that feedback to see if they can make any workflow changes. So thank you for that.
I'm wondering, and it might sound very simplistic, why are people booking appointments or walking in to be tested? Are they doing it out of curiosity? Are they doing it because they're symptomatic? And if they're symptomatic, at what point is the best time for them to come to be tested? Because I understand it takes maybe about 3 days in terms of testing for the virus to really manifest itself. And if they come right away, they might get a negative reaction. So what are people told if they get a negative test? So there are 3 questions, and I can repeat them if necessary.
Thanks, Henrietta. Yeah, I think the general guidance is if you are symptomatic, test as soon as possible, because likely if you're symptomatic, very likely right now, given what's going around, it's probably COVID. And if you're symptomatic, you're probably contagious. And then if you're not symptomatic, but if you've had exposure, I think the general guidance is test 3 to 5 days after that, for the reason you're saying that it would take a couple days for the virus to manifest. None of this is perfect. And I think folks are constantly trying to understand the dynamics of Omicron versus Delta versus any other variant. So just because you have a negative test one day does not mean that you do not have it. It might mean that you're positive, say, the next day, and the timing wasn't quite right for the specific test you were using. And it's also possible, I believe, for the PCR test versus the antigen test, of course, they're different in sensitivity as well. So that's another factor. So I think none of this is really perfect. There's not necessarily a perfect time, but that's the general guidance.
So if people do test negative, is it simply assumed that they don't have COVID, or are they told to wait a few days? What are they told in terms of a negative test?
So I think to Laura, which said if you have an exposure, so you have symptoms and then you test negative, then I think the answer would be that you probably don't have it. I mean, there are people who have that have had symptoms, have gone tested and don't have it. If you've been exposed and you should wait 3 to 5 days, that's when like she said, the virus has a chance to kind of build up in your system to actually see. So you should be masking. I think what we would say and what we in health would say consistently is that you should be wearing a proper mask. You should test if you think you've been exposed or you have symptoms. So those are kind of like our main public health messages that we're kind of pushing right now. So masking, good mask, one over, that's a little bit tight. If you can get N95 or K94, something that's tight around your face, and then testing if you think you're symptomatic or had an exposure.
So the first question, are people coming in because they think they have been exposed and they're symptomatic, or are they coming in a lot because out of curiosity?
So we saw a lot. That's a very good question, Henrietta. Okay,
Wendy, could you let her?
Can I something about that? Sorry. This is Wendy from Casa Círculo. Just regarding that question, for example, we have about 72 students in our center, and then we ask them to perform a test weekly, because we have seen in this from December to now, we have seen that many of the kids, they don't have any symptoms, and they have come with a positive test. So even if they use the mask and everything, and they're going to school and they're coming to the after school program, sometimes it's hard to know when a kid is positive. So for us, for security, for our community and the other students, we request the testing, so we can make sure that the kids are not infected, because they are not showing any symptoms. Thank you.
And so thank you, Wendy, for that additional information, and Henrietta for your questions. So what we heard anecdotally, and you cannot sort of there's no data to prove this, is that during this super surge that we saw over the holidays and into early January was a combination of exactly what you're talking about. People who thought they might be exposed or ill, and people who were just curious. So even my director had friends who went and got tested, and she said, well, did you have exposure? And they're like, no, we just want to know. So there was a definite combination of that as Omicron hit and everyone was really concerned. So it was generally you were exposed, you had symptoms, and there was just this level of curiosity from people that they wanted to know whether they had it or not, and whether they should then isolate or go to that party or those kind of things. So we've seen that every year around the holidays, where people test pre and post holiday to see if they can go or not, right? Even if it's not the 100%, gonna say that they don't have it.
And I think the other thing is that surge or no surge, it's a mix of people going more for surveillance testing reasons and for people going with people going for reasons of exposure or symptoms. And I think a lot of these testing clinics are not really meant for surveillance. Surveillance ideally would be covered by, say, employers and or schools and systems like that for the surveillance testing. But I think it's just a real mix in terms of people have access to surveillance testing that's needed for employment or schools, et cetera, through those avenues, or if they are needing to go to these public sites.
Thank you.
Laura, there's a question in the chat that how often are schedules updated, and does the county consider local pharmacies as partners in the testing of residents?
Yeah, thank you for that question. So for our county testing website, which I think it's smc.org/testing, we try and keep what's on the map, the map that has a specific county sites, as up to date as possible. So we would know of operational changes for those sites and be able to update the hours, et cetera. We are not always able to update if there are, say, temporary closures or delays or weather related or staffing rate related for that specific day. So of course, that's why we recommend always people get appointments, because whenever there are closures that are unanticipated for reasons like that, folks with appointments will be contacted by the vendor to cancel and reschedule. In terms of local pharmacies, absolutely, there are a lot of vendors out there, including pharmacies and healthcare systems, who test. And when we, a while back, looked at our numbers for our county testing sites versus all the tests done in San Mateo County, our clinics provide quite a small fraction of the overall tests conducted. I think it was on the order of 10 to 15%. So we think that the healthcare systems and pharmacies are testing quite a bit. Unfortunately, we don't have access to, say, schedules or any operational considerations, all of those details. So we do have some links for some of the big chains on our testing webpage, but we're unable to list specific schedules. It does seem like the state is working on right now on a bigger database of test sites. So they've asked us for information about our test sites, and they're going to be collecting from other vendors and providers as well. So hopefully there will be a bit of a more central database for that.
You both. I'm not seeing any other questions or hands raised. Trish, I know you had mentioned some vaccination updates. Would you mind giving just some quick updates on that side of things?
Yeah, sure, absolutely. So where we are in the sort of vaccine world with the COVID is that we are obviously still doing all our first and second doses with the three, the two mRNA, Pfizer and Moderna. Janssen is still being utilized at kind of more limited basis. There has been recommendations from the CDC to not utilize it, particularly for certain age groups of women, but also just in general. So we have it at our vaccination clinics, but we counsel or we give people information about the health risks associated with it. So currently, in terms of access, we have 17 what we would call standing or regular clinics around the county doing 12 plus first, second dose, third dose for immunocompromised and booster shots. Those are located at most of our outpatient medical centers. So like at our Coastside Clinic, our South San Francisco Clinic, Daly City, we're in two sites, we're at Pacelli and at the government center. We put it over to Pacelli because of the weather. We couldn't get both days. We're in South San Francisco Clinic, the main campus, and Fair Oaks, and then as well as EPA, we're at the YMCA a few days a week. So those are our 12 plus booster. We're having the event center will continue to run through February 12th and probably roll back at that point. Again, similar with testing, we've seen a big drop off in the numbers of boosters that people are requesting or the numbers of vaccines in general. We will be doing some work. My team will be doing some work to see kind of where we're still missing folks or people are missing either first or second or even their boosters. And we'll do some analysis around that and then really try to do some targeted placement of clinics and stuff. And not just clinics, but also information and guidance and information that could help anyone who might be reticent to get a vaccine. In terms of pediatric, there is the pediatric Pfizer vaccine has been approved for 5 to 11-year-olds. It's a 2-dose series as well. We've not heard anything about whether there might be a booster required down the line, but right now it's just 2 doses. We have, I think the county, we've done a series of school-based clinics in conjunction with the County Office of Ed. So like this week, we're doing a second dose clinics Thursday, Friday, and Saturday at College Park Elementary. Next week, we'll be back at Martin School in South San Francisco for 3 days for second doses. And then following that at Hoover in Redwood City for a series of second doses. We will then be, between now and when that finishes, we're working to set up, again, standing, regular, convenient clinics that'll be available for the pediatric population at sort of set sites throughout the county where we know we need to, kind of the communities we need to be in. We're using, just for information, we are using 2 separate vendors to do pediatrics versus this 12+ because we think the risk is a little too high to have a pediatric clinic in with an adult clinic. So we've seen, if you've seen news stories and stuff like that, of there can be trouble with, we don't want to hit a kid with too high of a dose. That's absolutely what we don't want to do. So we are going to separate out our pediatric clinics from our adult clinics. And so that we'll keep those sites running separately. So our plan is by end of February, early March, that we have in place our continued sort of standing clinics for the 12+ population, as well as our standing regular clinics for the 5 to 11 population.
Thank you for that, Trish.
Sure thing.
I'm going to pause once more just in case there's any other last questions. You can always put them in the chat as well and we can collect them. But I know we also wanted to hear from you all as well. I know it's been a while since we've met as a group, and it's been a while since we've heard community updates from each of the partners. Laura and Trish, thank you so much for being here. We welcome you to stay around if you have time and to listen in. And at this time, if there's no other questions, I'll pass it off to Petra to lead the group discussion.
Thank you, Laura and Trish.
Thank you.
Yeah, it's been a long time since we've heard from you all, and so we'd love to hear kind of what's top of mind for you as far as how's it going. We don't need, in the interest of time, don't want to hear everything that you're doing, but if there's like one thing that either is a problem or a success, we'd love to hear it. So who wants to start? Colleen.
I just figured, since I'm actually at my booth right now, our COVID outreach booth, I don't know how to flip the camera. Is there a way to flip the camera? Not that I can.
There is on Zoom.
I'll just show you that we've got this beautiful market here, and we're kind of in the thick of it, and we've got our where the vaccine sites are and all that, and our little logo there. I'm showing you anything. We've got information about the to get your tests from covidtest.gov. Bella is here. And we've got our free mask, which we posted in Russian, Chinese, Spanish, English. And we've given out about 30, 35, 37 masks. And we've had questions for people that have said, no, I don't want a cloth mask. I want an N95. We've got almost a dozen of those people. And not as many people asking about testing locations and whatnot, which I also have a list up of that. So that's what I have to report for right now.
Thank you for sharing. It's fun to see people out and about doing the work. So appreciate that. Who else wants to share? You don't need audio visual aids like Colleen had, if you can just talk.
This is Gloria, Flores, Garcia, El Concilio of San Mateo County. I think the greater frustration that I experienced was people wanting to get a test and couldn't get it fast enough. And I think you've explained some of the the situations that have come up and the fact that things are moving. And as we, with fluctuations and with demands from employers, but the no-show rate is something that we in the community have experienced forever. And so we have to, we just want to reiterate how important it is to know which is the fastest one that they can go to, and then they decide whether they can go or not, and that's another issue, getting from here to another city. But we're going to do as many of the appointments as possible, although sometimes it's too far out. And I see that the situations have changed because there's been less people wanting to get tests, but we still have to remain that flexibility and having the clinic availability there. So really appreciate all that you're doing as we move towards the various changes that occur, including staffing and volunteers.
Thank you.
I think the education in terms of the time educating the leaders and groups are the fact that there are these changes. These are realities. It's not that the county and other vendors are not trying to be flexible. I think that's what we want people to know, that they're trying to be flexible. They will allow walk-ins when possible, and the reality of all that it takes. So people do understand once they understand, but they are antsy or curious or needing to get that test or vaccination. And I think we're doing a pretty good job.
Yeah, there's definitely a lot of opportunity to be nimble with all of this, with everything changing quite so often.
Mm-hmm. Thank you.
Thanks. Anybody else want to volunteer before I start picking on people?
Hi, good morning. This is Wendy again from Casa Círculo.
Thank you, Wendy.
Well, we were one of the sites that Laura was giving the testing sites until last weekend. Last weekend was our last test. We were doing almost the first week of January. We did 284 tests, then 240 and 204 last weekend. Mostly were walk-ins for our community. So that was good. The people were coming to ask for vaccination too. So we were sending to the Ferox clinic, that is the closest one. We've been sending also the kids there is one on East Palo Alto. They are doing vaccination every Saturday. So they accept walk-ins too on the vaccine side. So we've been sending the kids in there. So we're having a good response from the community for doing the vaccination for the youngest population, the kids from 5 to 11. So that is good. We're happy to see that. And basically it's what we're doing. We're doing information. We're sending text message when the county send all the clinics that are available close by. We're sending a text to the community too, so they know where they can go or do an appointment. Thank you.
Thank you, Wendy. Vinny, I see you're off. Put your camera on, so that must mean you're ready.
Yeah, I'm ready. And post-holiday greetings from Healthways to everybody. Yeah, during the post-holiday, it was really a chaos because people, as I mentioned earlier in the the discussion from Tris and her team, people were panicking. They wanted to get tested, and then that's why I raised the question of how often the county schedule is updated, because we referred several people to the county schedule, And then when they, they saw that walk-in is acceptable or allowed, then they went there, and then they came back to us complaining that, hey, it's all appointments. And then, so plus the earliest appointment that they could get during the first 2 weeks, during the first week of January, was January 18, which is more than 10 days. So people who were symptomatic, we had to do some social GPS those symptoms, and they couldn't get tested right away. We advise them to contact their primary care doctors, and it's the doctor that gets the appointment for them for testing. And that's some, it has been a very successful route for patients with symptoms. Now, the education part that we're doing right now is how to use and how to read or interpret the antigen test result, because many people ignore the pink line. When there's a slight pink line, they say they declare themselves to be negative. But in the instruction, it says that whatever shade of a pink line it has on the test, then the person is positive. So that's the one that we're trying to educate right now, people in the community, proper use and interpretation of the antigen test. So that's all that we have been doing lately. Thank you.
Thanks. That's interesting that you need to do the education around the light pink.
Yeah.
I'll go next.
Thanks.
Hi, I'm Casey from Senior Co-Siders, and we're continuing to do all of the outreach that we've been doing for the last year. But we've also been able to do some additional tabling as people return to the center at events that other organizations hold in our space. So that's been great. And I want to just give you guys a shout out, and also a shout out to our Chamber of Commerce for quickly making the KN95 masks available, because we get calls or people stopping by almost every day asking, where can I get a mask? Where can I get a mask? So it's great to actually have them on hand and be able to hand them out. We're delivering them to all of our Meals on Wheels participants as well. So that's been really good. And again, I also want to give you guys a shout out for the excellent materials that you give us, so that we can quickly get new updates out to the field through social media and flyers and email blasts. It's been really good. So thank you for all the support. You've made it pretty easy to support this process. So thanks.
Thanks, Casey.
I can go next. I think one of the main things that we've seen at Puente is people not wanting to quarantine from work because there's no paid leave for sick leave. Even though we offer financial assistance, right now we have a backlog of 55 people needing appointments for financial assistance of wage replacement. So it takes a long time. It's not just as easy as they tell us they're not working and we write a check. The appointments are going all the way to the end of February right now. So people won't get those wage replacement checks until March, but rent is still due monthly and bills are still due monthly. So that's the main thing that we're seeing, people just not wanting to do tests. Even with our tax program, we're requiring all participants to do a test before they come into the office, and we are providing the test and we're helping them do the test. People don't want to know if they're positive or negative because they just don't want to take time off work. But other than that, I think, just like everybody said, we really hit the ground running January 3rd of just rapid test after rapid test and hitting, wholesale orders not shipping. But we were really lucky from HCH FH to receive rapid tests from them, and we still had some from last year, and we've just been distributing those, and really lucky with the partnership from Laura and Trish of all the vaccine clinics we've been able to host, and also COVID testing that was just planned last minute with Curative, and really grateful for our partnership with San Mateo County, Thrive, and everybody here today. Thank you.
We like partnering with you too. No, I think just kind of backing up to big picture, this has really built some really great relationships. Hopefully next time we can use them for more fun things. Joshua, you are new here, so introduce yourself. And you just raised your hand.
Hi. Yes, I am new, but I work with Helen actually in the Office of Community Affairs. I just have a brief update regarding our department's effort in providing masks. So we're starting the mask mobile again. We're still in the process of creating the schedule of like where we're going to be located all over the county. But as of this week, we're planning to be in Redwood City. I think we're gonna go to like a county center in Redwood City. I'm not 100% sure yet, but we will be there and we will provide cloth masks for this week. But then hopefully in the future, we will have surgical masks, if not N95 masks. And if anything, I will send everyone the schedule of where we're gonna be at moving forward.
Thank you. That's good to know that the mask mobile is back mobiling.
Yeah.
Miriam, do you have a question or you want to share?
Hello, it's actually a combination of both. Hello, everyone. So we've been really busy with the surge as other organizations, and I feel that at the beginning, there was definitely a lot of confusion around when to test and where to test because access to tests were limited. And I feel that community members are still confused. Do you test at day 5? I think that when they're experiencing symptoms, they want to get tested ASAP. But from what I understand is that might not necessarily be the best approach. So I've been participating in a lot of meetings so I can also stay up to date with the new suggestions so we can inform our community members. And I do have a question that came my way through another individual that works at a different county, and they work with a lot of undocumented agricultural workers. And these individuals got vaccinated under their legal name. However, at their employer, they're working under a different name. So the question was, what should they do? Should they can't get vaccinated again because otherwise it would be double vaccination. But then it's just a question that's just very confusing, and wanting to see if anyone had any guidance around that in terms of people who got vaccinated under their legal name but are working under a different name, and their employer is now asking them to show proof of vaccination.
That's certainly a tough one. Anybody have any experience or ideas?
I guess also but
The only thing I could think is, to ask a doctor to write a note, but I don't even know how you would do that.
Wow, that's a very difficult one. I'm wondering if, oh, wow.
Well, I'm wondering, is it possible for the county to be able to do something with one of the county doctors in terms of following up on writing the note?
The problem is the employer doesn't know that that person is not using.
Yes, I know, but if this situation is explained to one of the county's doctors, could the county doctor write a note for this person saying that they've been vaccinated?
That's what
I like the idea. I like
under the name that they have given the employer.
Yeah. Even community-based organizations, I'm wondering if a letter coming from them indicating that they verify that they have been vaccinated.
But would that work as medical proof from a respected physician?
Right, or clinic.
Yes.
Yeah.
I will also look into it. I think it's a really unique situation. And so I can also look into see, what can be done for the vaccination cards or supply medical proof in situations like that. So Miriam, I have noted it. And if I hear anything, I'll let you know.
Thank you so much. Yes, these are definitely great ideas. And the reason why I'm bringing this up is because it's someone from a different county, but it could potentially happen in our county down the road as well. So it's something also just to be cautious about in case it does. We do encounter cases like this down the road.
And we might, as there are more employers who are going to require vaccines, it might happen. Thanks, Miriam. Anybody else? There are lots of people who haven't shared yet.
Hi, this is Adam from South San Francisco Public Library. I can share a little. So I just also about the last question, I don't know if the employer would do just testing in lieu of vaccine proof, just on-site testing maybe. Hopefully an employer would do that.
Mm-hmm.
Anyway, okay, so in South San Francisco, we're excited about the resources coming to South San Francisco and that have started already from the county. And so we've been promoting those. Of course, the last couple of months, any, roadblocks, obstacles have been around our own staff being, exposed or testing positive for the virus. And so that definitely disrupted some of our outreach over the last couple weeks. But I'm also excited today by the call, this call today, and definitely have some ideas for moving forward about how we can help at the library, be a resource for helping people, find available appointments and going through the registration process. So thank you.
Thanks, Adam. Faisal, do you want to share? It's hard to tell when you guys are all not on mute. Oh, how about Camilla? Are you there?
Hello.
Yes, this is Salah.
Oh, hi. Okay, Camilla, you're next.
With Support Life Foundation. We continued just in general, I don't know if you remember, but throughout last year, we've administered over nearly 20,000 vaccinations throughout our county and other counties as well. And this year, the focus was really is to fulfill our duty with the county and disseminating information that's coming out. So every Friday, there is a gathering at the different mosques, and I usually give speeches or sermons or help with whatever. And we've been tabling throughout the last, continuously, ongoingly, to spread the messages that we receive, especially on on our platform with the county through you guys. So that's just the only update. It's an ongoing thing. It's a weekly thing. So that's one venue. The other venue is our food distribution, which is has gotten very high. And with that, if there's flyers that we picked up from your place, or others that we actually just reprint whatever you have from you, we insert it in our food boxes and we distribute it to the different, and it's different messages every week. wherever we end up being emailed to us and to the rest of the group here. So between the two of them, that's a lot of outreach. It's ongoing, weekly, week in, week out, and we're proud of it. People are saying coming back to us for information. We became like an information center to about a total of 6 centers throughout the peninsula. So that's the update on our site.
Thank you. We have a couple more minutes. Phil has a question.
Oh, I was just going to give an update.
Oh, great. Go ahead.
Yeah, so this is Felix from Self Help for the Elderly in San Mateo. So for us, we're continuing with our monthly mass distributions for our meal deliveries, and also we just reopened our center for in-person dining and also activities as well. So offering those to the folks that are coming in, although it's been very sparse. There's still a lot of concerns with our seniors actually coming down to the center, just for their own sake. So we're actually a vaccinated facility. I think we're one of the very few facilities that are requiring proof of vaccination for the seniors to actually participate in our programs. So it's been kind of a adjustment period, but folks are super grateful for us actually being open and actually allowing them to come in person and actually have some activities and socialization, as well as they're grateful when the messaging came out about the USPS providing those free at-home test kits, and a lot of them seem to be very interested in actually having the opportunity to actually have those test kits to test themselves, since the access to tests have been pretty difficult for some. So maybe in the future might have to try to explore if there's a way for us to actually get more test kits to distribute out to the community as well as possibly even hosting more test sites on our part here at the center in Central Park. But yeah, that's been pretty much what we've been up to in the last month or two.
Thanks, Phil. We're going to do a quick, we have somebody else raises their hand. We have Camilla, but we also have only 2 minutes left. So I would like, while we're talking, sorry about the phone, Kirsten's going to launch a quick poll about our next meeting. But do Camilla quickly and then Alexa.
Hello, can you hear me?
Yes.
Yes.
Oh, hi. No, actually, I just had kind of a question and or comment about the free testing kits that the federal government is offering, which I think is a great program, but I think you can only get it online. And I know we have a lot of seniors who are not very tech savvy. And so I don't know if there's any way that we could maybe put a request in that people could call to get those tests in order to make sure that everybody has access to it. That's the only kind of barrier I see, is that it's only available online.
There is a number you can call.
Oh, wonderful.
We will.
Maybe we can get it to you offline, or
we'll email it out to the group.
Okay, that would be great.
Alexa, do you want to finish us off?
Sure, sorry, I'll keep it short because I know it's already 11, but I just wanted to say, I'm not sure who's aware of this. Sorry, I'm from Ravenswood Family Health Network, but we have free rapid antigen tests for anyone at our vaccine clinics, and we have them throughout the week at our clinic in East Palo Alto, and you can get one kit for each member of a household. So I just wanted to put that out there as a resource. I know it requires people to come to the clinic itself, and also to our clinics in Santa Clara County, but just wanted to put that out there as a resource because our patients have been picking those up all the time, and we have a large supply. So in case anyone you're serving is in need of that, we're here.
A question, Alexa, do they need to be a member? Because that is one of the things we have to ask clients at our East Palo Alto office. Do they have to be a member before they can pick up a test?
I don't believe so because these vaccine clinics are open to patients and community members.
Okay, thank you.
Thank you all so much for coming. Next time we will be doing breakout rooms by region by a vote of 62% to 38%. So thank you for letting us know, and have a great day, and thank you all for the work you're doing.
Thank you all.